It's Medical Monday with the Center of Occupational and Environmental Medicine. We welcome Dr. Alan Lieberman with the autoimmune diseases. For our viewers who might not be familiar with that, what exactly is an autoimmune disease?
Well, it sounds like we're immune to ourselves, and that's exactly what's happening. The immune system is a surveillance system. It's constantly going around the human body looking for something that doesn't belong there, that's foreign. And when it identifies it, it kills it. The problem is that there is molecular mimicry sometimes, especially with microorganisms. And those microorganisms, especially like 90% living in our gut, sometimes are mimicking other tissues of the body, okay? So if the body recognizes the germ as a foreign thing, and then suddenly it looks at your own tissue and says, oh, it looks just like the germ, it's knocking off the germ. Now, most people recognize autoimmune diseases such as systemic lupus erythematosus, for example, scleroderma, or thyroiditis. 1 out of every 12 people has thyroiditis, which is an inflammation of the thyroid. But the big problem with autoimmunity is that you destroy a tissue and the function of that tissue then goes down. Last week, we saw a 13-year-old boy with autoimmune hepatitis from California. And this child is in trouble because his body is attacking his own liver. And the question is, what caused that? We were able to identify a microorganism, which was E. coli, a very common germ that lives in our gut, which was actually the offending substance. We were able to reproduce every one of the child's symptoms when we gave him sort of an injection of this particular bug. Now what we're going to do is we're neutralizing him to that organism in order to stop the immune system from attacking the liver.
Do you do this through medications or do this through an injection? How is that taken care of?
Either through injection or through drops. You see, like nitroglycerin goes under the tongue, it's very rapidly absorbed into the bloodstream. We use a lot of these signals, these antigenic signals, under the tongue.
And I'm sure through the child and through the parent, it doesn't matter what area you go through, whether it be an injection or just as long as the problem's taken care of.
It works.
Yeah, that is fascinating. What were, the symptoms of this young man that came in? Was this previously another doctor recommended you folks? Is that where it came from?
Yeah. Yes, with autoimmune hepatitis, the symptoms, for example, usually show up as jaundice, for example, loss of appetite. These kids are very sick, and because liver function is destroyed.
Wow. So now are you going to be able to help this child out where the liver is going to be able to act like a liver should be?
That's correct.
Oh, that is fascinating. All the way from California.
Yes.
Amazing. How do most people get a hold of you when they want to come in and see you? What is normally the steps? We've got about 30 seconds left.
Oh, they could just call area code 843-572-1600, and the delightful person will talk to them on the telephone, get some information, and see if our office is appropriate, that we have the skills with which to try to help them.
Absolutely. You've got 2 associates that are with you. You've been in the business.
Dr. Weirs and Dr. Herbert. And you'll be meeting those next week.
Absolutely. Been in the business for 50 years. Thank you for helping so many people out.
Thank you.
Appreciate it. We got more coming up after the break, so stay with us.